Hi viewers, we have with us today Dr. P.R. Prabhash, consultant in neurology, Apollo Specialty Hospitals, Vanagram. He is a specialist in balance disorders, which includes vertigo, dizziness, and imbalance. Let's talk to him. What is this balance disorder, doctor?
Namaste. I'm Dr. Prabhash, consultant in neurology, Apollo Hospitals, Vanagram. So, balance disorders are those disorders in which a person's ability to maintain balance is lost. So, whatever disease processes which interferes in a person's ability to maintain balance, those are grouped in a subspecialty which is becoming larger called balance disorders. The most common symptoms of these disorders are can be grouped into four headings. One, vertigo, where there is a feeling of spinning sensation. Second, something called dizziness, where there is a rocking feel, but here the spinning sensation is absent. Three, there is imbalance or unsteadiness while walking. Uh, person might need help or to support so that he doesn't lose balance. And third is pre-syncope, where there is the feel that you get when just about fainting.
How common is this problem, doctor?
This is one of the most commonest symptom with which a person tries to get a medical attention. I would say that around 35% of persons above age of 40 and almost 85% of persons above age of 80 uh, have some sort of balance disorders.
Will you be able to enumerate some common causative factors for vertigo?
Yes. I would say around 40% of any persons who, if you take 100%, 40% of those will fall under otological, that is ENT disorders. 35% will fall under medical causes, including neurological causes. And 25% is still difficult to diagnose. Maybe most will have some psychological or psychiatric issues too.
Why does this disorder occur?
Okay, so it's because of an illusion that you are losing balance. For that, we should know the physiology behind how we maintain balance. There are three things. One, the vision. The second, the vision will tell us what's happening around us. The balance system, that balance system means the vestibular apparatus and the connections inside the brain, tells us how we are moving around. And third, the information from the muscles, joints, and the nerves will tell the brain that where, even if our eyes are closed, we will know where our hand is, where our head is, where our leg is. So these three informations are mixed and matched inside the brain. So when there is a mismatch between any of these, there is an illusion, which is called, which results in vertigo or dizziness or instability. So, for example, if you are sitting in a train, in a railway station, and when the opposite train starts moving, what we will feel is that we are moving. Actually, it's an illusion. What happens here is the eyes will tell our brain that, oh, we started moving. But then the body will cross-check with other two systems. Or then the balance system will tell the brain that, okay, we are not moving. So then the brain corrects itself, thinking that, oh, this is what the other opposite train is moving. So it's an illusion. Same happens in vertigo as well as dizziness.
I have seen people suffer from vertigo for years together. What can be done about it?
Okay. So the primary problem here is vertigo is not a diagnosis. It's actually a symptom. We need to find the cause behind the vertigo. Only if we are able to find the cause behind the vertigo, we will be able to treat. We need to, so the person has to consult a balance disorder specialist so that the cause is identified and the treatment can be optimized for the cause.
What is the most difficult part and the most important part in balance disorders?
The most difficult and the most important part will be the history. I would say that without a good history, we won't be able to diagnose in a given patient. The difficult part is because of low awareness. The person the patient is not able to explain their symptoms in words to the doctor. Okay, this is what is happening. So, for example, the symptoms are varying. If you take in Tamil, the patient might say that gear, that that word doesn't carry much. We don't understand the meaning of that. தலைச்சுத்தலா இருக்கு, மயக்கமா இருக்கு. So because of the low awareness, they are not able. The patient is not able to explain in correct words. So that is the most important problem. But then it can be overcome. We would put certain. The doctor can put certain efforts so that we are able to understand clearly what the problem is and then sort out.
What is your approach in dealing with this problem?
Okay. So as I told earlier, history is the most important thing. History that any doctor will be trained in taking a good history from MBBS days. But here in this symptom or the vertigo or dizziness is where it comes handy. It applies to any symptom, but then in this symptom it's pretty handy. And it can lead up to almost 90% of the diagnosis can be made by a good history itself. So the most important things are the quality of the episode, the timing of the episodes, and the triggers in those episodes. For example, quality means we need to hear the patient's symptoms clearly, and the attention to detail is the most important thing here. For example, a person is getting dizziness at around 11 o'clock and at around 5 to 6 o'clock in the evening, and it continues for months. And by the time he takes food, his dizziness improves. So common sense has to be applied here. It's because the low blood sugar in the blood is causing that. It's called hypoglycemia. It's causing those symptoms. When you take timing, timing is the most important thing I would consider in the history. For example, if it lasts few seconds, it indicates one diagnosis. For example, BPPV, that is benign paroxysmal positional vertigo. If it lasts from minutes to hours, it can be some other diagnosis. For example, stroke. If it lasts from hours to days, it might signify one diagnosis. It may be vestibular migraine. It's also called migraine associated with dizziness these days. If the episode lasts for years together or months or years together, it may signify a diagnosis. For example, psychogenic dizziness usually lasts like that. So it all, then the third is triggers. Triggers, the patient will not be able to say. The doctor has to put some effort to ask those things. For example, those episodes will come when we turn to sides. Mostly if a person complained of an acute attack, while turning it comes, especially while lying down and turning it comes. The diagnosis mostly will be BPPV, that is benign paroxysmal positional vertigo. So then certain times, if we miss a meal, we are getting episodes. Maybe it's a vestibular migraine. Travel triggers episodes. It can be a motion sickness, or it can be vestibular migraine itself. So the history is the most important thing first. So by the time the history is ending, I should able to put the patient's symptoms under one among the four, as we earlier discussed. Either it's vertigo, is it dizziness, is it imbalance, or pre-syncope. This will be my approach by the end of the history, and then I will put it under two headings: whether it is an acute episode that the first time that patient is coming with, or is it chronic. So the approach will differ from both. And then it's all about neurological examination as well as otological examination, and then try to narrow it down to the nearest diagnosis.
We have a question from a viewer. I have a pain on the left side of my head, on and off. May I know the reason for that?
Okay. This is in a way not related to the balance disorder, but anyway, the question. This looks like I need to know a bit more clearer about the headache, whether it's acute onset or it has been there for long and episodic. If you ask me, this looks like a migraine to me. If it is there for at least 4 or 5 episodes has happened over past few months, then it can be grouped under migraine.
What are the treatment options for migraine, for vertigo, doctor?
Okay. The treatment options depends on the cause. Again, we should diagnose exactly what the problem is, and us from the history as well as examination, we narrow down and do the investigations part, and then we come to a diagnosis. So the treatment depends on the diagnosis. For example, if it is benign paroxysmal positional vertigo, which is the most commonest one, the treatment is actually repositioning maneuvers. Means there is a crystal has formed inside the apparatus, vestibular apparatus. There are some tubes which is filled with liquid, and there is a crystal formed inside that liquid filled tube, and when it moves, there is vertigo. So the idea will be to reposition it to an area where it can safely settle. There are medications too to settle the immediate, the acute attacks are severe, and it is really terrifying for patients. So to reduce the acute attacks, there are certain medications. And if it is vestibular migraine, as we discussed earlier, we have to give anti-migraine medications. I've seen patients suffering with vertigo for years together, but put on when there are certain criteria to diagnose vestibular migraine, and when it fills up the criteria, we are going to treat as vestibular migraine. We have seen good results with that. And simple things like when you get up, there is a sudden dizziness or vertigo. Most probably it happens in someone who's taking antihypertensive medications. It can be just that when you get up, the blood flow to the brain is reduced. It's a very common symptom, and you need to adjust the antihypertensive medication. Also, whenever you get up, be careful while getting up. Sit down in the bed for a few minutes, and then hang your leg outside the bed for a few minutes, and then get up. This can be a treatment for that. So what I meant is the treatment depends on the cause.
Will you be able to enlighten our viewers on the tests that are conducted to determine the severity of these disorders?
Test again depends on the cause. We find out the cause, and then there are two ways of looking at it. We have to look at structural integrity and then functional integrity. For structural integrity, we do MRI brain and with an inner ear sequence to find out the abnormalities, especially if someone has come with an acute episodes. Functional integrity is primarily checking the ear. That is video head impulse testing, audiogram, and this is functionally how it is going. That's what we are going to test in those.
This is a common question, doctor. Does the treatment type to cure vertigo, dizziness, or imbalance require admission in hospital?
If it is acute and if it is severe enough, disabling symptoms, then yes. But most of those vertigo doesn't need an inpatient admission. Most is an OP treatment. But then if it's acute, especially if stroke is suspected, yes, inpatient admission is advised.
Is it safe for a person with vertigo imbalance problem to travel?
Unless it is acute, definitely I don't see any problem in the patient is traveling.
I have been diagnosed with labyrinthitis. What to do next? And I am 35 years old.
Okay. Labyrinthitis means there is a sudden hearing loss as well as imbalance. Usually that is the combination with which the person comes. It is actually an ENT disorder. I would suggest immediately to consult an ENT surgeon so that it's 100% treatable. It's treatable. I wouldn't say 100%, but it's definitely treatable. Treatment options are there, but you should consult at the earliest.
I'm suffering from central vertigo with constant migraine. I'm fed up of this problem. Please help.
Okay. This is a technical term, the central and peripheral vertigo. Technically, it means that peripheral means the vestibular apparatus which is behind the ear, which helps in picking up the movements. If there is a problem in that, it can produce peripheral vertigo. And central vertigo means as I told, the mixing up of all these three information, the vision, the hearing, and from the nerves. This happens centrally. So if there is a mismatch in that, the problems happen centrally. Here, as he told, he has been diagnosed with migraine with central vertigo. Here, The treatment is we have to use anti-migraine medications to treat, and it will have good results.
I'm suffering from symptoms like feeling of the surrounding spinning, vomiting and nausea, rhythmic movement of eye. Is this vertigo? Can I be cured?
Yes, as you told, the spinning sensation is there. So it is a vertigo. If it, as he said, while turning, can you read that again? Is it during turning?
Rhythmic movement of the eye, is this vertigo?
Vertigo. Okay. So if it's triggered by movements, it is most probably due to benign paroxysmal positional vertigo. As the word benign indicates, it's not a serious condition. It is treatable.
What are the cause and prevention of dizziness?
What are the cause?
And prevention of dizziness.
Okay. Causes, I would enumerate few diseases. The most common is, as we earlier discussed, benign paroxysmal positional vertigo. This is one of the most commonest causes for vertigo. As the term indicates, it's benign and it's easily treatable. There are two ways of treating it. One, we need to, the cause is because, as I discussed earlier, there is a crystal which has formed inside the tube which is filled with liquid. The crystal is already there in some other place. It has come to it is misplaced into this area. So we try to reposition it. We try to turn the head in a specific way. There are guidelines to do how to do those. It's an OP procedure, doesn't need admission to. It doesn't last more than 15 to 20 minutes. We can reposition it to the area which it already belongs to. The second way is treating with medications, because acute, it is terrifying when the balance system is connected with our limbic system, which deals with fear and anxiety. So when you get BPPV, because most of them will come with an acute symptoms, and they will be, it's a terrifying experience. So we give medications to control reduce the intensity of the symptoms and control a bit. But there are certain things what we should remember. There is something called vestibular sedatives, which will reduce the vestibular functioning. Means there is the stone, that the crystal is formed in the left side ear. What we are because the left side ear is triggering, the right side ear will act more. So by giving this medication, vestibular suppressant, we are actually suppressing both the ear. So we should remember that we are also suppressing the normal ear. So it should not be used for longer periods. Vestibular sedatives usually should be used for around 3 to 4 days max. And there are other medication like beta histine, which is the most commonly used medication, which can be used for some longer time. The second most common disease is vestibular migraine. It's recently renamed as migraine associated with dizziness or vertigo. So here the episodes of there will be episodes of vertigo or dizziness. There will be episodes of headache too, which might run parallelly, which might occur at different periods of time too. So with associated history of migraine, there might be family history, and there will be triggers. Like when I expose myself to bright lights, it comes. Maybe if I expose the person to loud sounds, it might come. Stressful situations. If the sleep is disturbed, or like traveling might trigger. So these are so triggers are pretty important in migraine. And certain food habits, maybe coffee might reduce, maybe chocolates might increase, or ice cream might increase. So there will be some triggers which we can pick up. Third is vestibular neuritis. Here, one part of the vestibular nerve or the apparatus has got an acute problem. It is treatable. We can give an IV medication and we can treat it immediately. So there are some clinical signs which will tell us. Also, there are some scans are needed for that. The third will be Meniere's disease. It is a bit of a difficult disease to treat, but I would consider that it's again an overdiagnosed problem. Usually, the persons with Meniere's disease will have vertigo plus an abnormal sound in the ear. It's called tinnitus. Third, there can be feeling of oral fullness, that ear is bit full and bit imbalanced too. And the person will have also hard of hearing. It doesn't need to be all of these things should be together. It might be in within years, these symptoms can coexist or at different periods of time. Again, it's a bit difficult to treat, but treatments options are available. The other thing, as we discussed, labyrinthitis. Here, the hearing as well as the vertigo system, the balance system, as well as the hearing system is involved together. It is treatable. There are, but the amount of function that we can retrieve maximum, there can be some limits on it. So these are the certain causes and the treatment for. Yes, I missed the most important thing: stroke. Yes, the dizziness, as we discussed earlier, these dizziness can be due to the mixing up that the information received all mixed up inside the brain. So what happens is, when there is a problem in this this information mixing and matching, there can be dizziness, especially when when there is a problem in the posterior part of the brain, that's called cerebellum, or the brain stem. These are the common areas where dizziness can come. Also, in any type of stroke, dizziness can be there. So if a person has developed a sudden onset vertigo or dizziness, especially associated with maybe a facial lag or any double vision, or a reduced sensation in one half of the body, or there is a weakness in one half of the body, or is there a problem in swallowing, or when we swallow there is a cough, or there is difficulty in in chewing. So if there are vertigo associated with any neurological symptoms, we usually, especially when it is acute, we suspect a stroke. The stroke is a medical emergency. You should go immediately to a stroke-ready hospital. These days, strokes are completely, if the person is able to go to a stroke-ready hospital on time, within 4.5 hours to 6 hours, we will be able to revert the stroke symptoms completely. So certain times, vertigo and dizziness are emergencies too.
Is vertigo common in all age groups?
Yes, it can come in any age group. As we discussed, it's common in, rather than putting as vertigo, I would try to bring in the word balance disorders, because vertigo, dizziness, and imbalance, instability, is common as the age grows. Like it is, as we discussed earlier, around 85% of persons with age above 80 has some sort of balance disorder, mostly imbalance. It's because most of them will have some damage to the nerves, probably due to diabetes, so that might be interfering. Then strokes is more common in the elderly age group. Multiple factors associated with it. So any age can be affected, more towards adult and bit aged.
Can the symptoms of and cure for vertigo be different in adults, children, male and female?
I don't think so. Again, I repeat, it depends on the cause. It's all look. What you try to find the causes and treat accordingly. I don't think an age difference or a gender difference is going to cause in the way the treatment is changed.
Doctor, what are the common risk factors involved in vertigo and dizziness?
Risk factors, yes, as the age grows, I told, maybe diabetes, which can affect the nerves. Diabetes and hypertension can increase the chance of one person getting strokes. Stress can increase migraine and cause vestibular migraines. Stress can also cause strokes. So these are the risk factors. This, as alcohol can damage the nerves and can cause dizziness. It can also damage the cerebellum, that's posterior part of the brain. It can cause dizziness. These are the common risk factors. And sleep is pretty important. And a disturbed sleep pattern can also increase the chance of the person, the worsening of phobic dizziness can be there when the sleep disturbance is there.
Sir, I'm 48 years old. Repeatedly from last 30 days, my head spins, entire body feels numb when I go out on walking or while driving. What can be the reason? And I'm not a diabetic.
Okay, here there is a vertigo associated with a neurological symptom, that is numbness, and it comes on and off. So here I would consider a diagnosis of a TIA, that is transient ischemic attacks. That means that transiently the blood supply to the brain is interfered. I think you should consult a neurologist at the earliest.
Sometimes I have been feeling fall down to the ground. Pardon the grammar. This problem have been experienced since 25 days. This happened when I think deeply. Kindly give me some suggestions.
Okay, there are two things. One, there is, as we discussed, it falls under the third heading, that is instability. The person is he is feeling that he is being pushed down or he is about to fall down. I would be happy if he is able to say that which side it is, but that's okay. So plus he said one more thing, that if he thinks more, the episodes are there. So this one, yes, definitely in this person too, we have to rule out a stroke. We have to think about that one. Second, whenever he thinks more, the episodes are more. So probably a phobic dizziness is also a possibility that we already discussed, that the limbic system is connected to the balance system. So whenever you get anxious, and in a person who has all features of a phobic dizziness, in those people, when anxiety is more or stressful periods are, whenever he is stressed out, the possibility of dizziness is more.
Hi doctor, my name is Maya, I'm from Bangalore. My dizziness is accompanied with problems with vision, instant hearing loss, with tingling and numbness. How to overcome this?
Okay, here there are dizziness, she said very clearly, I think we take that word, one. So second, vision symptoms are there, though she is not able to classify it a bit more about the vision symptoms. Okay, we'll take the vision symptoms. And third, what is the third symptom?
Tingling sensation.
Tingling sensation. And in the ear, and one more symptom that she had.
Instant hearing loss, tingling, numbness.
Okay, so hearing loss and then numbness. So here it's multiple. In neurology, we need to localize first before coming to a diagnosis. So dizziness with there are some vision symptoms with hearing symptoms and numbness. I would think about a brain stem involvement here, though it looks a bit too much, but then all these symptoms put together, we need to think about a brain stem lesion. So we need to, the person should be evaluated by a neurologist.
Doctor, we've heard about cervical spondylitis. It can trigger vertigo. You didn't mention about it.
Okay. So while enumerating the diseases, I didn't mention about this. Look, I think the cervical spondylosis causing vertigo and dizziness is not as common as it was thought earlier. Previously, we thought it was very common, but there are certain reasons. Now the researchers have proved that this is not that common. Most of the patients who was diagnosed to have cervical spondylosis, if we put more effort, we were able to find out one cause or the other in most of the people. Second, there is no evidence to say that yes, this is the problem which is causing it. And third, most of them responds to the if that person is able to we were able to put it up in a diagnosis bracket and then treat, most of their symptoms improves. So the experience over the years have taught us that it is not as common as earlier thought.
Thank you very much, doctor, for this very informative session. That's Dr. P.R. Prabhash, consultant neurology from Apollo Specialty Hospitals, Vanagaram. For your queries and any kind of inquiries, you can call the number 74016-80248. I'll repeat, 74016-80248, or the landline 2653-7777. Repeat, 2653-7777. Namaste.
Namaste.